Hey Chris, it's Luke. I've got ID2 inside the governor's mansion for a Okay. Yep, do that right now, no problem. Yes.
So it's like a mic check? Mic check?
Yeah. Great, thank you. Alright, go on.
Testing, 1, 2, 3. Testing, 1, 2, 3. Testing, 1, 2, 3. Testing, 1, 2, 3. Good to go?
Good.
Awesome.
Are you okay? No, I thought you were Yeah. Here we are.
We're actually either in Yellowstone.
Fun, just fun.
Like very intimate.
Yeah.
Anyway, you know.
That's all right. Okay, my brain is going to go. We're doing really good this year so far. You know, I think that's part of being a state fan. Yeah, that's probably the same. Or you're supposed to be the game as well. Or the company game go into the game. Usually you're like early for the week. Yeah, same here. Just curious, is anyone live streaming?
Yep.
Okay, okay, cool. Yeah, of course. Thanks for coming out. Yeah, you did.
Well, good afternoon, everybody. Thanks for being here. On Friday, I directed Kody Kinsley, the Secretary of the North Carolina Department of Health and Human Services, who's with me here today, to begin immediately the process for expanding Medicaid. In a minute, he's going to give you some more details. But first, I wanted to reflect a minute on how and why we are here. Make no mistake, this has been an unnecessarily long and agonizing journey for many North Carolinians. But today, the hope that has stirred in so many across our state will become a reality. Today, we finally know the date of the start of life-saving health care for North Carolinians. And it's a good feeling. From the moment that the Affordable Care Act passed more than a decade ago, giving states the option to expand Medicaid, North Carolinians all over our state began the drumbeat to get the job done here. Since January the 1st, 2014, states have had the chance to say yes to billions of dollars and hundreds of thousands of health insurance policies for working people. People who earned too little to afford health insurance coverage, but too much for Medicaid coverage. And for 8 years, North Carolinians were denied, and Republicans emphatically said no. But after much convincing work by many supporters that changed with the passage of the bipartisan Medicaid expansion bill of March of this year. The only catch in that bill was that the Republicans insisted that Medicaid expansion be tied to the budget, even though it was unnecessary. Now, after months of waiting, the budget has passed, and Medicaid expansion will happen. I know there's a lot of bad in the budget that they've passed. And I expect lawsuits to challenge the constitutionality of a number of parts. And I cannot, in good conscience, sign my name to it. And even though a veto of this budget would have been well deserved, that would take this bill out of my hands and send it back to this legislature, where even more mischief could have put Medicaid expansion at risk. In this legislative circus, we can't take any more chances on delay or defeat with the lives of so many people at stake. So now, Medicaid expansion is ready to launch. Since my very first day as governor, getting help to people who need it by expanding Medicaid has been a top priority. I hear countless stories from everyday people, many who earn a living working 2 or more jobs to make ends meet. But it isn't enough to afford health care. You're doing everything right, but they still can't get ahead and can't feel secure without worrying that bad sickness or an accident could bankrupt them. I talk with workers straining every day to keep our economy going while suffering through pain or illness that they cannot afford to treat. I meet with parents who watch adult children fall to opioid addiction, unable to afford health care that could save them. I've had a child care worker with a sick husband show me a letter telling them their Medicaid insurance has been canceled when it wouldn't have been had expansion been in effect. To many of these families, I say now, finally, help is on the way. With much work being done to prepare, even as we speak, beginning December the 1st of this year, North Carolina will expand Medicaid. And on that day, we should have our first enrollees. On Friday, I spoke with top federal leaders at DHHS and CMS. And today, Secretary Kinsley will share more about the actions that he has taken to be ready, as well as the work that lies ahead. I want to thank Secretary Kinsley and his dedicated team for their tireless work to get Medicaid expansion passed and get our state ready for it. Even though they had to go through shifts and stops during legislative delays, he and his team have been strategic, they've been thorough, and they've been willing to do whatever was needed to get life-saving care to the people of this state. And I think several of them are standing over there, and I thank them. This will be a new day for health care in North Carolina. To all of the longtime supporters and to those who are just now seeing the light, I say thank you. And now I'll ask Secretary Kinsley to share his updates.
Thank you. First, I'd like to thank the coalition of organizations and people across this state that have made this possible. Thanks to the legislators who fought for this for so many years to get us to today, and a special thanks to my team at the Department of Health and Human Services, who have been working for this moment for a very long time, nights and weekends for years. But of course, we could not be here today without Governor Cooper's unwavering leadership and commitment to serve North Carolina. Medicaid expansion is a game changer for 600,000 North Carolinians that it will directly benefit. It's a game changer for healthcare providers, for hospitals, especially in rural North Carolina, who now, with incoming payments, federal dollars through Medicaid, will be able to sustain their operations and keep their doors open. It's a game changer for North Carolina's economy, which will have the benefit of billions of dollars flowing into North Carolina, dollars that we had left behind for too long. Of the 600,000 people that will receive coverage through expansion, about 300,000 North Carolinians will be moved into full coverage on day one, December 1st. For the remainder of those that are eligible, our county partners have been hard at work to ready their systems and their staff and their processes to enroll members as they come forward. We've been working with partners and nonprofits across the state to prepare to make awareness to individuals so they can come forward and get ready. And at our department, our team has been working very hard to update technology and other systems so that we can move these individuals into coverage as seamlessly and as quickly as possible. We have one of the highest rates of automatic processing for eligibility in the country. We've taken advantage of every possible flexibility the federal government has given to us to make this process smooth for people. Those 300,000 people and getting them coverage as quickly as possible on day one weighed heavy on us at the department. And me personally, as some of you know, I grew up in North Carolina without health insurance. I know firsthand the struggle that families face when trying to balance weighing the risk of going without seeing the doctor, or parents pushing off prescriptions because they can't afford food on their plate for their kids. This is a game-changing opportunity for us to push forward, and I'm so thankful to my fellow employees of the Department of Health and Human Services and to Governor Cooper for pushing us to today. In this budget, with Medicaid expansion, it also unlocked a $1.6 billion signing bonus to come into North Carolina to make key investments in health. And I'm proud to report that the legislature did invest about $700 million of the governor's $1 billion investment plan in behavioral health. Several hundred million of those $700 million are recurring that will come every year to make key investments in behavioral health rates a key priority for the department. Policy investments that will allow us to better serve people with serious behavioral health and intellectual and developmental disabilities. Investments in emergency departments and DSS offices across the state. $200 million to support our child and family well-being work so that children don't have to sleep in DSS offices and we can serve people in hospitals better. These investments were only made possible and unlocked because of Medicaid expansion. It is a game changer. I am thrilled that we are to the point where we can finally go live December 1st. And to the 600,000 North Carolinians that will receive their health coverage after so many years of personal turmoil and struggle, I have one final message. We've got you covered.
Now, Secretary Kinsley and I will be glad to take questions that you guys might have. Sir.
Governor, looking back, you've worked on this for nearly 7 years, and I can remember early 2017. How I remember it is you kind of tried to do an end around the legislature, getting the Obama administration to accept Medicaid, to embrace Medicaid for you. And in 2019, you had the budget impasse that was partly based on Medicaid expansion stalemate. Do you have any regrets in terms of how you pushed the legislature to go forward? Do you think another way could have made it quicker?
So we used everything that we could muster in order to get Medicaid expanded. We got a group of people across North Carolina that's one of the most unusual coalitions that I have ever seen, of people who believed that this was the right move and were unafraid to say so, even though it may have been politically unpopular in their party. For example, getting tough on crime Republican sheriffs to come to the legislature and say that a lot of the people that we are dealing with need health care and not handcuffs. Getting rural hospitals engaged with the legislature saying, in order to stay open, we need to have Medicaid expansion. Getting rural chambers of commerce to say, we've got a lot of people who are uncovered and a lot is falling on the private sector, and we need this help in our rural areas to succeed with economic development. Finally, all of that pressure made the legislature say, okay, it's time to do it. No, I don't regret a single attempt to expand Medicaid because I think it has led us to this day. There's still 10 other states throughout this country that haven't expanded Medicaid, and I hope that they can take some of the lessons of the coalitions of people that we've been able to put together to try to succeed. So our attempts to expand Medicaid when they sued us in federal court to stop us, trying to get Medicaid expansion through the budget, working to have people all over North Carolina come to the legislature and encouraging Republican legislators to go and meet with them. All of that has helped. And I want to thank a number of the Republican legislators who continue to push this effort within their own caucuses to finally make this happen. Yes, sir.
I had a couple if that's okay. The first one, if the federal government shuts down in a few days, will that have any impact on the implementation timeline?
Secretary Kinsley and I have had a few discussions with federal officials. They do not believe it will affect Medicaid expansion. Their technical people will continue to be on the job, and we believe that even with a federal shutdown, we will still be able to begin this on December the 1st.
Other questions?
So what were some of the steps that had to happen so that the December 1st, date could be set?
I'll turn that over to Secretary Kinsley.
There's a number of steps that have to go into place to make sure that we can go live. So first are a series of policy steps and getting approval from CMS and the federal government. Again, we have been working on this. We've attempted to go live several times now, waiting for the General Assembly. And so we had done a lot of that pre-work in advance and negotiated with the federal government that they would accept that. Second, there's a number of technical changes that we've had to put in place into our eligibility system to evaluate people's eligibility based off the different income thresholds, but also in our connection to the federal marketplace, which we know we're about to go into open enrollment. And so people who apply for health insurance there may be redirected back to us because they'll be known as Medicaid eligible now that they've updated those systems. We're putting that in place. We're also identifying individuals that are currently within our family planning benefit, a much lighter benefit. That's where those 300,000 people are, because we have access to some income information that they've either applied for Medicaid in the past or their SNAP benefits. We're able to identify them as eligible to move into the full benefit. We'll need to send them letters, inform them of the process, let them know what to expect. We'll start to do that in the next few weeks. And then last but certainly not least, a significant amount of work with our county partners. Eligibility occurs in county departments of social services all across the state. We have been working with our social service workers to make sure they can understand the process, make sure they know how to use the new eligibility system to go through that. And we've also put significant investment, advancing several $1 million to our county government so that they could hire up eligibility staff and be ready for the December 1 go live. So there's a significant amount of work leading us to this day, and still a significant amount of work between now and December 1, but we're looking forward to a strong go live.
And a quick follow-up. And so for the folks who won't get eligibility, almost immediately, how long do you expect that will take for them to get approved for Medicaid and really expanded parameters?
So, it will depend a bit on how they come forward. Individuals will need to come forward. These are people that are not currently in the Medicaid program or not necessarily known to us. We're looking at other benefit programs we operate to identify them, to reach out and nudge people to say, you may be eligible, but they still need to come forward and apply. And so we're guiding them to that process, to that front door. That's also why we've been working with community stakeholder groups, churches, other faith organizations, civic organizations, to make sure that they're informing people that could be eligible to consider it and to come forward. What we've seen in other states as they've gone live is that there's so much information about coming forward and getting access to health coverage that some people figure out, oh wow, I was already eligible for Medicaid and I didn't know it. Or I was eligible for a subsidized plan on healthcare.gov and I'm going to take advantage of that. Our goal, we have 1.2 million people in North Carolina without health insurance. Medicaid expansion is going to do a major effort in getting that gap closed. We want to close that gap as much as possible because health insurance coverage is step one to better health, and that's the step we're taking.
Got time for one more. Any other questions?
Are you going to get your veto stamp on it this week?
Likely. Thank you, guys. Appreciate it.